Welcome to the deep dive. Today we're venturing into, well, a really unique corner of the medical world, hyperbaric nursing.
Yeah, it's fascinating.
We've got our hands on some chapters from Hyperbaric Medicine Practice, and we're focusing specifically on the hyperbaric nursing section. Our mission really is to unpack the key aspects of this specialty for you.
And it's quite a specialty. I mean, think about it, a nursing role that needs top-notch clinical skills, sure, but also managing, the whole high-pressure environment inside a chamber.
Exactly. It's like this blend of critical care thinking, high-tech gear, and really close patient support, all happening inside this pressurized room.
It demands a very specific set of abilities.
Okay, so to really get our heads around this, where did this idea, this field of hyperbaric nursing even come from?
Well, the story's quite interesting, actually. It really starts back in Europe. Physicians there were the pioneers using hyperbaric oxygen. Dr. Barema in Amsterdam was a key figure. His research, using the Dutch Royal Navy's chambers, specifically had a nurse on the team, which is quite telling.
Right from the start then, nursing was involved. So the Dutch Navy had the early setup. What happened next?
Well, 1959 was a big year. At the Wilhelmina Gashuis in Amsterdam, they started using a big multi-person chamber for open heart surgery.
Open heart surgery in a chamber. Wow.
Yeah. And the nurses. They were operating room nurses who actually volunteered for this. Imagine volunteering to work in that kind of environment back then.
Or nurses stepping up for that. That really speaks volumes, doesn't it, about their, adaptability.
Definitely. And it wasn't just surgery for long, right? The uses expanded.
That's right. As they saw how hyperbaric oxygen could help with things like carbon monoxide poisoning, gas gangrene, nurses started providing more general patient care inside the chambers.
Okay.
But initially, it was pretty much on-the-job training. These early nurses were really figuring things out in a brand new clinical setting.
You can just imagine that learning curve.
Yeah.
A totally novel environment. But that informal stage, it didn't last forever. They got more structured training eventually.
Oh, yes. Formal training programs did start up later. Both the Dutch Royal Navy and the Hyperbaric Department at Wilhelmina Gashuis offered them.
Okay.
And what's interesting is, around the same time, in the 60s, intensive care and coronary care nursing were really taking off.
Right.
And that kind of critical care experience actually became a prerequisite for hyperbaric nurses.
Ah, okay. So that really highlights the level of sort of clinical skill needed. It wasn't just about the pressure.
Exactly. It was about caring for potentially very sick patients in that unique setting. And this wasn't just happening in Amsterdam, was it?
No, not at all. Glasgow, for instance, at the Western Infirmary, they set up a multi-place unit. And again, specially trained nurses were key. They handled patients getting treatment for wounds, CO poisoning, anaerobic infections.
So the expertise was spreading, consolidating in other places too?
Mm-hmm. And then the technology changed as well.
Ah, the chambers themselves.
Exactly. Vickers introduced monoplace chambers in England, single-person units. So now, nurses weren't just providing care in the chamber, they were also being trained to actually operate these things, manage the whole treatment.
Right, running the show.
Yeah. And later, nursing auxiliaries were also trained as technicians to help out.
So different roles emerging alongside the tech. And these monoplace chambers, they spread beyond the UK.
Oh, yeah. After a program in Stockholm got one in 1964, their use really expanded globally.
Okay.
Which meant a wider range of people, nurses, techs, respiratory therapists, started getting trained on these different hyperbaric systems.
Sounds like a real period of growth and maybe professionalization for the field. What about North America? How did it catch on there?
Well, surgeons at Harvard were doing early research, using a U.S. Navy decompression chamber for cardiac surgery studies. And that work sort of paved the way for multi-place facilities in the 60s, Boston Children's, other big hospitals in the U.S. and Canada.
And similar to Europe, who were the first nurses involved over there?
Again, operating room nurses were crucial early on. But just like in Europe, as the uses broadened, you saw nurses from critical care, ER, MedSurg getting involved too. It really shows the diverse clinical base needed for this specialty.
It's fascinating seeing those parallel tracks, on different continents, both building the field. And it wasn't just the hands-on care, right? Nurses were actually advocating, helping shape the programs.
That's a really important point, actually. Nursing was vital in planning these early programs. Mount Sinai in New York is a great example.
Okay.
It was set up as a real collaboration, nurses, doctors, administrators working together. And the nurses proactively identified what was needed. Staffing, training, patient support, even research needs.
Like laying the groundwork for the specialty as we know it today.
Pretty much. And it's quite telling the hyperbaric department there was actually organized under nursing.
Wow. That really underlines the leadership role nursing took early on.
Absolutely. And you started seeing this reflected in the professional literature, too.
Yeah, our sources mention that. The 60s and early 70s saw more articles on HbO2 therapy in nursing journals globally,
Right. And notably, most of them were written by hyperbaric nurses.
which suggests a real drive to, share knowledge and build the practice from within.
Definitely shows ownership, developing that distinct expertise. There was even a nursing textbook published back then that really dug into the hyperbaric nurse's role specifically.
Not just articles, but textbooks. Okay, so it's really solidifying as a specialty. And like any growing field, people needed to connect, organize.
Exactly. So nurses and respiratory therapists started meeting up at international hyperbaric congresses in the 70s.
Hmm.
Then, in '82, the Undersea Medical Society, the UMS, created the UMS Associates section. That really boosted nurse membership and, representation within the broader UMS.
Building those networks, sharing best practices, and Memorial Medical Center in Long Beach, they played a part too.
They did, yeah. Their annual conferences on clinical HbO2 became a real hub. And crucially, starting in '78, they added workshops specifically for nurses, recognizing their unique needs.
Right, so all this effort, individual and collective, it led to a big milestone, didn't it? Formal recognition.
It did, 1985.
Yeah.
The founding of the Baromedical Nurses Association, the BNA.
The BNA, okay.
That was huge, officially recognizing hyperbaric nursing as its own specialty within nursing.
Started with 35 RNs, and now it's international. What does the BNA actually do?
Well, its main goals are promoting professional activities, making practice more effective, providing education and networking, developing standards of care, evidence-based ones, and supporting nursing research. It's really the professional home for hyperbaric nurses.
And importantly, it helped establish specialty certification, right? Giving nurses a clear path for growth and recognition.
Absolutely. A way to validate their specialized skills and knowledge. It's quite a journey, tracing how it all came together.
It really is. Okay, so let's switch gears a bit and dive into the practical side. What does a hyperbaric nurse actually do today? It sounds like a role with many hats.
It truly is. Many roles, but the core is being a clinician, using that fundamental nursing process assessment, diagnosis, planning, implementing, evaluating, all tailored for the hyperbaric setting.
So the standard nursing framework, but applied under pressure, literally, what's that look like day to day?
It means assessing each patient, their specific risks, their overall state, both physical and psychological, developing that individual care plan, then actually administering the HbO2 treatment based on protocols and doctor's orders. Constant watchful monitoring during the whole session is absolutely key.
I bet.
Managing any complications that pop up, evaluating how the patient responded afterwards, and of course, documentation. Meticulous records, usually electronic now, are crucial.
That constant vigilance and detailed charting, standard nursing, but maybe even more critical here. Beyond direct care, you mentioned education is big.
Huge. Educating patients and families is essential. Explaining how the therapy works, helping them adjust psychologically to the chamber, teaching them signs of complications like barotrauma in the ears or sinuses, vision changes, oxygen toxicity, low blood sugar for diabetics.
So preparing them for the experience, but also empowering them to spot potential problems, that must be vital in such an unfamiliar setting.
Absolutely. And their teaching role goes beyond the patient, right?
It does. They often educate other healthcare staff and the community too, presenting at conferences, doing in-services at their hospitals, contributing to websites, really raising awareness about hyperbaric medicine, acting as knowledge brokers, advocates for the specialty. Another key role mentioned is researcher.
Right. This is where they help advance the field's knowledge. They collaborate on medical studies, give treatments according to research protocols, sometimes help develop those protocols and report the findings. They're often involved in testing new hyperbaric tech too. And they contribute to lab studies and human trials, especially in areas like, say, wound healing.
So right at the forefront of innovation.
Yeah.
And it's not just supporting medical research, there's nursing-led research too.
Exactly. Hyperbaric nurses are increasingly doing their own studies to better define their own role, understand how patients respond physiologically and psychologically to the chamber,
Okay.
and ultimately to support evidence-based practices in hyperbaric nursing itself.
Continuously improving care through inquiry. Got it. Lastly, the sources talk about management roles.
Yes, many experienced hyperbaric nurses move into management, running the department, basically.
Okay.
So they're responsible for resources, staffing, supplies, equipment. They supervise patient care, coordinate all the clinical, educational, research activities, and crucially, They ensure compliance. State laws, Joint Commission standards, NFPA fire codes, especially all the safety stuff for the chambers and emergency plans.
So managing not just clinical care, but the whole complex operational and safety side too.
Yep.
It really paints a picture of a very comprehensive, demanding role.
Okay, considering all that, what kind of qualifications and specific training do you need to become a hyperbaric nurse?
Well, the foundation is solid MedSurg experience, adults and kids. But our sources really stress, and most places require at least a year of recent critical care experience.
Critical care. Makes sense given the potential for acute issues.
Exactly. It really underlines the level of judgment and skill needed.
What else? Other qualifications.
Current ACLS, often PAOLS too, are usually essential. Good communication, leadership skills, vital for coordinating care and directing support staff. And, given the tech, being comfortable operating the chambers and related equipment is a definite plus. Oh, and being available for on-call emergencies is pretty common.
Right, so clinical skills, people skills, tech comfort. What about the physical side for nurses working inside the multi-place chambers? Well, obviously a current nursing license is mandatory. But yes, there are specific physical requirements for inside attendance.
Okay.
Usually involves a medical history review, a physical exam, specific tests to make sure you're fit for the pressure changes. Certain conditions can be disqualifying seizure disorders, poorly controlled insulin-dependent diabetes, major claustrophobia, things that could pose a risk inside.
Seems like sensible precautions for the nurse and the patients, and pregnancy is a factor too.
Yes, pregnancy is an absolute no-go for working inside the chamber. Potential risks to the fetus. It's a key safety guideline.
Safety first, absolutely. Okay, thinking operationally, staffing. How does a unit figure out staffing levels and the team mix?
Yeah, that's usually dictated by regulations and accrediting bodies like the Joint Commission. A common approach is cross-training.
Makes sense.
So RNs learn to operate the chambers, and techs are trained to assist inside under RN supervision. Using on-call or resource staff helps cover shifts and emergencies, and also helps prevent burnout, and reduces the risk of decompression sickness for staff who are frequently inside.
Right, spreading the load.
And usually, there's a nurse executive overseeing all the nursing care in the department.
That cross-training seems very practical. What about the specific hyperbaric training itself? What's in that curriculum?
Everyone involved in patient care and chamber operation gets comprehensive training. Theory of hyperbaric medicine, clinical practice, technical procedures, patient safety in that environment. It's all covered. And hands-on training, supervised practice, that's absolutely vital. You can't just learn this from a book. The depth of training might vary a bit, depending on patient acuity and the setting. Nurses caring for critically ill patients need more advanced training on using life support gear under pressure, for example.
A tiered approach based on need. Who provides this training?
Well, in many multi-place units, there might be a dedicated facilities manager with technical expertise on the systems. But patient care responsibility, that stays firmly with nursing. An RN should really be in charge of patient activities.
Okay.
As for formal training programs, various medical centers offer them, specialist educational companies too. The UHMS actually keeps a list of approved courses, and sometimes the chamber manufacturers offer equipment-specific training.
So several ways to get that specialized knowledge. What core topics are usually covered for nurses?
It's pretty broad. Starts with the history, how HBO2 works physiologically, the gas laws, clinical standards, potential complications, patient adaptation, safety protocols, pharmacology under pressure, the specific conditions treated, bit of diving medicine, wound healing, infections, the nurse's specific role, critical care in the chamber, even things like reimbursement.
Wow, comprehensive.
Yeah, and ongoing education, annual skills reviews, both basic nursing and hyperbaric stuff, are essential to stay competent. It's a field that keeps evolving.
Continuous learning is key. Okay, let's zoom in on specific nursing issues during HBO2 therapy. What are some common challenges hyperbaric nurses manage?
Well, the sources point to a few key potential problems that need specific nursing care plans. Risk of barotrauma ears, sinuses, even lungs from the pressure changes.
Right.
Anxiety, fear, claustrophobia from being in the chamber, the potential for oxygen toxicity from breathing pure oxygen under pressure, and also HBO2 can worsen hypoglycemia in diabetics.
So physical and psychological challenges, how do nurses intervene?
For barotrauma, it's a lot of patient teaching on equalizing techniques, swallowing, yawning, Valsalva, maybe giving prescribed decongestants. During the treatment, they watch closely for signs and can adjust the compression rate.
Okay.
For anxiety reassurance, clear communication, teaching, relaxation, sometimes prescribe meds if needed. For oxygen toxicity, again, education on early signs is crucial, plus close monitoring and protocols to switch to air briefly if symptoms appear. And for diabetics, it's strict blood glucose monitoring before and after treatment and working with the medical team on adjusting food or meds to prevent lows.
Very proactive, very responsive care. Adapting constantly. Patient orientation must be huge, given how unfamiliar this all is.
Absolutely crucial.
Yeah.
A thorough orientation is fundamental. It covers how HbO2 works, coping strategies for the chamber, signs of complications to watch for, safety rules, emergency procedures, how to clear their ears, and why quitting smoking is so important for treatment success. Using visual aids, giving time for questions, making sure they really get it, that makes a huge difference to their experience.
Making them feel informed and empowered makes sense. What about kids? Treating children must have unique challenges.
It definitely requires special skills, addressing their physical needs, but also their fears confinement, being separated from parents.
Yeah.
So age-specific training and skills validation are essential for nurses working with kids. PAL certification is often required. Having a parent inside the multi-place chamber, if possible, is incredibly helpful. Plus, using distraction stories, movies, toys. Guided imagery can also work well for anxious kids.
Using those family-centered, kid-friendly approaches, adapting the care is key. Okay, looking ahead. What are the trends and maybe challenges for hyperbaric nursing?
Well, the sources suggest growing demand for hyperbaric nurses, which is good. More facilities, more patients benefiting.
Right.
We're also seeing a big focus on wound management in many centers. So hyperbaric nurses are developing real expertise there, sometimes even acting as consultants for complex wounds outside of HbO2.
Interesting. So, a chance for specialization in wound care. Overall, sounds like a field still growing and changing.
Definitely. It's dynamic, constantly adapting to healthcare needs and the environment. But challenges remain. Maintaining top-notch safety and quality care while dealing with reimbursement complexities, that's an ongoing balancing act.
Safety, quality, reimbursement sounds familiar across healthcare, doesn't it? Well, this has been a really thorough exploration of hyperbaric nursing. To maybe wrap up the key takeaways?
Yeah, it's clearly a highly specialized, dynamic field. It's got this rich history, and it really demands this unique mix of advanced clinical skills, technical ability, and very patient-focused care, all within that challenging high-pressure setting.
And as we saw, the nurse's role has evolved so much, from those early pioneers to today's highly skilled professionals who are integral to everything: direct care, education, research, even managing departments.
It really highlights that interplay between technology, physiology under pressure, and just fundamental compassionate nursing care.
It really does. And it kind of makes you wonder, doesn't it? What other niche specialties in healthcare might offer similar unexpected paths for growth using such a diverse set of skills? Definitely something to think about. Thanks for joining us on this deep dive.